Will we remain? Will our spark turn to fire? My feelings have changed. Am I fighting in vain? I heard the sound of the ocean. It was headed our way, followed by thunder, the roar and the rain. But will we remain? I'm strong enough to stay. I'm full of joy and pain. We were made this way. But will we remain? I'm strong enough to stay. I'm full of joy and pain. We were made this way. My hope has started to fade, but the feelings grow deeper. I hate living this way, scared that I'm getting weaker. So I smile to your face and pretend that I'm happy, longing for your embrace. Is this the price that I pay? But will we remain? I'm strong enough to stay. I'm full of joy and pain. We were made this way. But will we remain? I'm strong enough to stay. I'm full of joy and pain. We were made this way. Our hearts are on fire, though nothing has changed. But still we remain. Still we remain. Still we remain.
In the confines of a photograph lives a child who once was me. Oh, do you see? I still see through those eyes.
state I'm in. I was the one that you always said that you wanted. I was the one that you always just took for granted. I know that you might not meant those bad times. At least they made me feel alive. At least they made me feel alive. At least they made me feel alive. Can't apologize for the helplessness I feel. Even just a smile makes me wonder if it's real. A single love just to bring us back where we started. A single love makes me think about where your heart is. I know they might not have meant those bad times. At least they made me feel alive. At least they made me feel alive. At least they made me feel alive.
Attention please. Send your collie to the nurse's station. Send your collie to the nurse's station. Thank you.
Guys, hold on, hold on. Sorry, I had to listen to that. Oh, it always lines up so perfectly. Right with the start of stream. Guys, oh my god, 3 freaking days in a row. And this one's extra cozy. Because it's like sleeting, frozen rain outside. It's nice.
Awoo. Hugs
Oh.
Cinder then sneaks off to eat one of the sheep.
Here, I took one. Oh my god, hold on.
Alright,
Wow.
what nonsense is going on here, D? Thanks for the 5 months of fun and informative streams 3.
Okay, hold on. Air Arctic Wolf coming with the tier 1 sub for 7 freaking months. Dude, Air Arctic Wolf. You're coming to
100
college. Hold on.
bitties for the goodness. You said we can't buy you a tablet, but I did want to chip a few Washingtons in.
I'll get to that. Hold on. Air Arctic Wolf, I got you covered in collar care from the frigid air to the wolf tail. You're covered. Also, if you touch my sheep, I'm gonna come for you. I'm gonna find you, and I'm gonna tell you right now, Air Arctic, I'm very good with needles. So you watch out. Lametharon coming with the tier 1 sub for 5 months, dude. Loam. Low. Loam, you're covered under collar care from the name that sounds like a medication to the Khajiit tail. I got you covered. Loam, you're fun. You're fun, Loam. Nuo coming in with 100 bits. I know you said we couldn't buy you guys a tablet. You said we couldn't buy you a tablet, but I wanted to chip in anyways. Well, thank you, Nuo. I appreciate it. I actually got one. It came in yesterday. During my stream, I got my tablet. It's here. You guys are going to see how horrible my handwriting is. I practiced a little bit, but man, it's going to be bad for the first few streams until I get used to the tablet. So bear with me, but it's here. It's here. Rick, thanks for the bit. Guys, geez, I haven't even taken a sip of coffee. Too soon, dude. Hey, welcome in. Mighty Voyager, Phase Eagle, Silverfall, Blizzard Storm, Rick the Foyo, Nitrax, Nuo, Riley the Fox, DC Flash, Loud, Lametheron, Biko the Wolf, Wolf Thunder. Thank you to everybody. Who did I miss? D. Brandon, I see you. Dan the Wolf. Dan the Wolf. I think we got it all. I think I got all of them. I don't know, maybe not. If I missed one, I don't know, sue me. If you can think you can win in court, I doubt it. Ambrosia, hey, good meowing. Good meowing to you too. So today, we're gonna talk about the GI system again. Like a month ago, we did the GI system. We're gonna do it again, but this time we're gonna talk about what goes wrong. But first, coffee, and then afterwards, more of the Turing test. This game has been really fun. I've enjoyed it a lot. Arctic Wolf coming with the 89 bits, making Tux dance. Look at that werewolf. Quality USDA Prime werewolf. Erotic, thanks for the bits. I appreciate it. Thank you. Thank you. Coffee time. But yes, it is currently sleeting, frozen rain, sleet, not quite snow. But you know what? It's good enough to make it nice and gloomy and dark outside and cold and wet and miserable that I don't want to go back outside the house. So I'm just going to stay in here and stream with you guys and hang out because it's nice and cozy. We're going to get all comfy, cozy, wear our comfy pants and our comfy sweatshirts and maybe get a nice comfy blanket and just snuggle up. Dim the lights. If you can, change the color. I wish it was actually snow though. It has hand tracking too. It does. 1, 2. Hands. I can do that. Ball? Yes. Give, please. Give ball, please. That wasn't a question. It was a request. Oh god, I screwed that up. Oh god, I screwed that up. That wasn't a request. That was a demand. Give me that ball, please. Moose, diffuse moose. Guys, you know what happens if you back up too close to the moose? Well, he grabs you, and it startles you. So don't back up too close, because otherwise you're in for a scare. I'm on quarantine. I'll say Cinder Collies made the last 2 days bearable. Oh, wait. Are you have the vid? Do you have the COVID? The Rona? Oh God, not the Rona. Keep it away. Only select collies. I'm proud to be in such a limited group of collies that get grabbed by the moose, I guess. Who's a good boy? Me. I am. I hope. Maybe? Please? Ugh. Do I want a treat? Of course. I mean, what kind of a question is that? Who actually asks, like, hey, by the way, do you want a treat? Like, of course I want a treat. Now give it. Come on, give it to me. Right here. Ah. Right here.
Hey Cinder, may I offer you a cheesesteak on this snowy day? No mayo,
yes.
of course.
Actually mayo. Please? None of that cheese whiz either. I want real provolone. Real provolone with onions and peppers and mushrooms. Sounds good. Brilliant, thanks for 25 bits. And the cheesesteak. You gonna try to draw your first protogen? Good luck. Good luck. I hope it turns out well. I want to learn something, but I must go to English. Bye. Bye. Take care. Watch the VOD. It'll be up later. Provolone or extra provolone? Expertivolone? Lum. I don't get it. I like provolone though. Although it does make you constipated, but hey, it's delicious nonetheless. Nickname, thanks for the follow. Welcome to Floppy Flock. Welcome in. Chicken cheesesteak is good as heck. Yes, I like to make it for Tux and I. Every once in a while, I'll get in the mood to make, like chicken cheesesteaks, because you know steak is expensive. So I just get a couple chicken breasts, you cut them up, season them, fry them up, add some onions and peppers and mushrooms and cheese, and then throw it on a nice toasted bun. Now, I'm a stickler for buns. And I know that's going to be taken out of context, but my buns need to be toasted. If I get a sandwich without a toasted bun, especially if it's like a warm sandwich, like a Philly cheesesteak, for example, a cheesesteak, that bun has got to be toasted. Otherwise, it gets all like soft and mushy and gross. No, you gotta toss. You gotta toast it. You gotta toast it. Too much cheese can either constipate you or send you running. Yes, too much cheese will just kind of like jam you up a little bit. Nothing worse than soggy buns. I know, right? I want like the toast. When you toast the bun, it gives you like, it just gives it that crunch, right? It gives it that support. ER meme review when? I don't know. I don't have enough memes for that. Who likes eating tasted buns? Toasted buns. Toasted buns. I like eating toasted buns. And tasty buns too, but toasted. Shadow Fluffy Boy, thanks for the bit. Want one of my favorite pizzas with a lot of Italian ham and mozzarella? Sure. I'm not a picky eater. I'm really not a picky eater. I'll eat like anything. Really. When are you collabing with Dr. Mike? I don't know. Was that Dr. K? The guy who rated us that one time? I'm not gonna reach out. No. Who is it? Who's Dr. Mike? I watched your YouTube Q&A on YouTube yesterday. Thanks. Did you like it? I hope. Panera's bread, toasted chicken, avocado melt rolls. Yeah. Oh, what is the? Is that like the? Yeah, that's the chicken avocado melt on like that nice toasted squishy bread. It's good. It's like a mixture of both. Thoughts on French toast? Delicious. What coffee do you usually drink? I'm cheap. So I like Folgers, but right now I'm drinking, it's called Rostov's. It's in Richmond, from Richmond, Virginia, near VCU campus. There's a little shop called Rostov's, which does coffee beans. And when Tux and I were down there recently, we got some coffee beans. And it is absolutely delicious. But also I like my coffee black. I know that's probably gonna be the next question, black. Speaking of, I'm out of coffee. Hold on, I gotta grab more coffee. Be right back. More coffee. More coffee. Black coffee is great. It is great. You get all the flavor of the coffee without any of the calories of the things that make it taste better. Which is fine, because I think coffee tastes great anyways. Also, this is like the end of the pot. This is it. Oh, God. Something wrong with the mic here. It caught voice cracked. It made my voice something wrong. Test mic. The mic screwed up, messed up. It made my voice crack. It's the end of the pot. I'm out of coffee. I got no more coffee after this. I'll have to make more. That's okay. It's still good. The YouTube video was very cute and I love that first video. Oh, thank you. Thank you. I want to make furry coffee brand. That'd be great. I'll buy some. I'm always looking for more coffee to try. The background reminds me of hospitals, and hospitals mean nurses. My boyfriend wanted to be a nurse. We broke up, so it reminds me painfully. Well, I'm a nurse, so...
Hi, Cinder.
Dude, Rex Collie coming with the tier 1 sub for 10 freaking months! Rex Collie, holy freaking crap! I see you. 10 months. You're getting a founder badge if we ever make partner. Rex Collie, you're covered under collie care. From the actual flops to the actual beans, I got you covered. Blizzard Storm, take care. Rex Collie, thanks for the 10 months, dude. Seriously. You've been here for a long time. Long time. What game? Were you here for the start, Rex? Were you here when I played Satisfactory? Sage to the ear, hey! I'm waiting for my coffee to cool down, and then we're gonna start classroom time with I got a new tablet. So expect some issues the first few times. We'll work through it, and I'll get better with it the more I use it. But at least now, I no longer have to use the mouse doing that weird thing. I can just write. It'll be great. Cinder art? Yeah, no. I'm so bad at drawing. I'm not even gonna waste my time. Not even gonna waste my time. I have no desire to learn how to draw at all. I gave up that ambition back in college, and I'm fine with where I'm at. I will let the artists art, and I will teach, I guess. I found my niche. I'm gonna stay in it. Make it a channel point redeem? No. Not doing it. Not doing it. All right. I expect the highest quality of diagrams only. Expect to be disappointed. That's probably what's gonna happen. Is you're probably gonna be disappointed in me, Lone. You just expect it. Embrace it. Own it. Those who can do, those who can do, those who can't wipe a mean butt. I do wipe a mean butt. I know how to wipe a mean butt. I've wiped a lot of them in my life. Anyone know anyone who is in some... Is this for math physics? Wait. What do you mean? That sentence trips me up. I don't know how to read that. You do nursing, Diffuse can do his singing. Exactly. And Diffuse can also enjoy pineapple on pizza in secrecy. Well, while in the same moment pushing forward anti-pineapple propaganda. Yeah, it's a bit of a double standard. He secretly likes it while at the same time talking about how terrible it is. Unbelievable. You think you know somebody. Diffuse, don't judge me. You know I'm right. Dex doesn't stream. Hey. What happened? You left the stream for a while? Nothing. Who does physics teaching lessons? Oh, maybe someone out there does. I am bad at physics. Alright, I gotta make some room on my desk for this tablet. One of these days, Cinder, you're gonna wake up at a con with a bunch of hot dogs with ketchup on them all over you, nothing but wieners and ketchup. That's the day you die, Diffuse. Also, that'd be disgusting. That'd be gross. Ketchup in the bed. Oh, the smell. Bring it on. I'm not scared. Neither am I. You've seen what I can do. You've seen what I can do in Among Us. Ruthless killer. Ruthless. If I can nip ankles, I can also stab you in the butt. Lone, you're eating a hot dog with ketchup on it? Well, it is not my place to correct poor life decisions. You're welcome to make whatever decisions you want in life, no matter how badly they negatively affect you. I am not going to intervene. Cinder's done time in Twitch jail. I'm an institutionalized dog now. You gotta do what you gotta do to survive. Cinder versus Moose, who will win? Find him out when we throw him in the ring. I have a feeling Moose will probably win. He'll just gore me with his antlers, and then I would be bad. I'm not a fighter. I'm a lover. Are injuries related to eating ketchup on hot dog covered under Colicare? Absolutely not. No. You knew what you were getting into when you put ketchup on your hot dog. Ugh. Oh, God. All right. I gotta rearrange my desk a little bit here. Hug him. Let's see who hugs better. I don't know. Who would hug better? Confused. We should have a hug off, which sounds kind of like a tug off, but a hug off. It's different and not TOS. Don't use the tablet as a coaster for your coffee mug. I won't. I won't. What? Diffuse? It was too easy. Low-hanging fruit. Going back to the slammer? No, I don't want to go back. Please. I don't want to go back. People who know how to heal, people know how to hurt them quickly by consequence. It's true. We know all the weak points. Juliet, don't do it. Don't do it. I'm cozy. It's comfy snowstorm stream. It means I gotta be comfy. Dude, Tremor the wolf. Hi, Tremor. Tremor, hi. Hi. I didn't even know Cinder owned a tugboat. I don't own any boats. Why would you ever own a boat when you could just go swimming for free? You know what boat stands for, right? Stands for break out another 1,000. That's all you gotta do is spend money on the damn thing. Is it practicing masseuse? Is it amazing how it's amazing how many spots you learn that hurt? Oh yeah. Especially, you just gotta go for the vital organs. You gotta go for those juicy ones, like the kidneys. Ooh, those juicy kidneys. Or go for the liver. You hit someone in the liver, you hit them in the liver hard enough, their whole body like shuts down. Oh, it hurts. Dude, Peculiar Fox coming with the tier 1 sub for 7 freaking months. Becky, always so good to see you. Peculiar Fox, you're coming under Colicare, from the fox ears to the fox tail and the peculiar look of your fox. I got you covered. Thanks for the 7 months, dude. Holy crap. Hope you're well. The juicy kidney, yes. Juicy kidney with a side of fava beans. All right. Pineapples on pizza are delicious, and I eat my hot dogs with ketchup every day of my life. You had me in the first half, I'm not gonna lie. Oh wait, no, that's not the right meme. I agree with the first half, disagree with the second half. Cyber Panda!
Cinder 7 love.
Look at that werewolf. Cyber Panda, thanks for the 100 bits and make it Tux dance. Look at that werewolf go. Prime werewolf. Cinder 7 love. Alright. Classroom. Class time. I gotta set this up. Come here, tablet. I'm not used to not looking at what I'm writing on. I think that's gonna be the hardest part about this, is getting used to that. Also, the fact that my mouse is now like smushed between my tablet and my... I need more room! I don't got enough room on my desk. Alright guys, you know what time it is? It's time for class. It's time to sit down. It's time to shut up. It's time to put that ass in that chair because it's time for class. If you're late, I'm going to call your parents. If you're eating food in my class, you're going to get gassy. And you're going to embarrass yourself in front of the whole freaking class, so don't do it. And get ready to learn. Alright, let's see if I can do this. Oh. Hey, there we go. Tablet. Good enough. good enough for government work. GI issues. We're talking about diseases of the gastrointestinal tract today. Also, I gotta do this. Oh God! All right, the tablet is officially broken in. The tablet is officially broken in, and then you got to do this guy too. That 3D cube. There you go. The tablet is now broken in. Legit a kid. Hey! Hey! What's wrong with being a child? It only so happens that, like, I'm a child who's also in charge of deadly medications that'll kill you very quickly if not given properly. But I also laugh at fart jokes. Scuffed cube. Hey, it was good. My cube was good. Don't be making fun of my cube. Your nose is bleeding. Can you have some cocaine? No! You can't. You haven't gotten bad enough yet. It's got to get really bad for there to be cocaine. All right, so just like... oh, God. Hello, check, 1, 2. His microphone keeps causing voice cracks. I don't know what's going on with it. In order to understand GI issues, remember when we talked about, we got to understand how the GI tract works. So if you remember earlier, like, I don't know, a month ago maybe, we talked about we talked about the gastrointestinal tract, right? But as a quick reminder, your mouth goes down your esophagus, or when you eat, food goes down your mouth. Let me start up. When you eat, food goes into your mouth and then down your esophagus, into your stomach, which then empties into your small intestines. The duodenum, the jejunum, and the ileum are the three parts of the small intestines, which then empties into the large intestines, also known as the colon, where it goes past the appendix, up the ascending colon, across the transverse colon, down the descending colon, through the sigmoid colon, and out the rectum. Right? That is the movement of food through your body. Right? You have accessory organs such as your liver, your pancreas, and your gallbladder, which help make up a bunch of juices to help digest and break down proteins and nutrients in your food for digestion. And then your large intestine works to absorb water. Okay? That is the general way food moves through your body after you've eaten it. Like that delicious cheesesteak that I was offered earlier. Okay? So we're going to kind of start working from the top down when we talk about some of these topics. I'm going to go over a few of them. I'm going to skip over like some of the accessory ones. So for example, we're not going to talk about cholecystitis, which is gallbladder inflammation, because that's not, I mean, it's part of the GI tract, but we're not going to talk about that. A lot of people probably know someone who's had their gallbladder removed, a cholecystectomy. Pretty common procedure nowadays that happens when your gallbladder gets inflamed. We just take it out. You don't really need it anyways. We're not going to talk about pancreatitis, and we're not going to talk about any liver or bile issues either. We're going to talk strictly about the GI tract, the esophagus, the stomach, the small intestines, and the large intestines. Okay? Can I repeat? Repeat what? Your mouth goes down to your esophagus. Your mouth attaches to your esophagus. You eat, and then food goes in your mouth, you chew it up, and you swallow it down your esophagus. Your esophagus is your eating tube, remember that. So, the first one, we're going to start, like I said, from the top down. Oh God. Oh God, that ending! Drawing a straight line is hard work. Here we go. GERD. Who knows somebody who has GERD? Do you yourself have GERD? You ever heard of GERD? Do you even know what GERD is? So gastroesophageal reflux disease is heartburn. Who's ever had heartburn before? Can't even draw straight. I'm trying. The writing is way better. Well, thank you. Sweet. Already more better. Already more better. Yeah, more better. Yeah, that's the word. Down, fluffy boy. Sit down. Stop being dramatic and sit down. Otherwise, you're going to the principal's office. Legible? Yes, it's legible. Thank you. So, gastroesophageal reflux disease is chronic heartburn. Who's ever experienced heartburn before? I'm sure like a majority of us have experienced heartburn before. But do you actually understand what heartburn is? So heartburn, essentially, what happens in heartburn is gastric juices from your stomach leak up into your esophagus. And that gastric juice and acidity hitting your esophagus causes pain and discomfort that we perceive as heartburn. So it feels like a burning pain kind of right in the middle of your chest there, right? That typically can get better with like antacids or sometimes I'm trying to forget if laying down helps or not. I always forget. But you can see here in the picture, all right? You have your esophagus right here, right? And then you have what's called the esophageal sphincter, right? Yes, I know. Sphincter is a funny word, right? Because, you know, buttholes and stuff. But a sphincter is just a name for something that squeezes shut, right? Like a hole that squeezes shut. So typically what happens is as you eat food, it bypasses this esophageal gastric sphincter or whatever it's called, esophageal sphincter. I forget the name of it. Is this the pyloric sphincter? No, it's not the pyloric sphincter. Forget the name of it. Anyways, this should open and then close, preventing backflow of stomach acid into the esophagus. Sometimes what can happen is either through damage or foods that produce high like stomach acid content, such as like fatty foods, can start to kind of erode away at the sphincter, where you might have some esophageal or some gastric juices splashing up into the esophagus. This is what causes heartburn. Typically, you're going to feel burning pain, in your chest. Sometimes it gets worse with eating. If you have this chronically, so if this happens more, like some people just get like intermittent heartburn, right? We've all probably gotten heartburn before. But when this becomes a chronic issue, that's when you get diagnosed with GERD, which is gastroesophageal reflux disease. How do we treat this? Typically with medications like PPIs, which are proton pump inhibitors. This would be like your Prilosec, your Pepcid, those types of things that help reduce the amount of stomach acid. So less acid. Right? You can also alter your diet to make sure that you're not going to have any foods that's going to irritate or exacerbate your GERD symptoms, such as like fatty foods, spicy foods. These are all things that are going to make it worse. Very common thing to have. We see it all the time. Not really anything too concerning. What can happen is if you get it bad enough, this constant damage in this area here can cause some of these cells to become cancerous, and you might get some kind of like esophageal cancer, or this might become kind of fibrotic and damaged from the constant acid exposure. So that is something that is concerning, right? This can also cause bleeding here as well, where if it starts to break down enough, you might have some kind of like GI bleed where you got blood coming into the stomach now, right? And that's obviously not good. But generally speaking, GERD by itself, while uncomfortable and something that needs to be treated, not necessarily emergency. In my country, this illness is called Zagaga. Why? Barrett's esophagus. Yeah, I always forget. I think Barrett's. I always forget what Barrett's esophagus is. Damage to the lower portion of the tube that connects the mouth to the stomach is usually the result of repeated. There you go. Okay, so it's essentially what I just described. I just forgot that it actually has a term, and it's called Barrett's esophagus. So just constant exposure to acid to that bottom part of the esophagus can damage it. Barrett's is like pre-cancer. Makes sense. to change up my order of doing things here. Here's my next pick. I'm going out of order because we're going to stay with the esophagus for a second. So that's GERD. Causes of this, like I said, obesity can make this worse. Bad diet can make this worse. Like fatty foods, that kind of thing will make this worse. Some people are just genetically predisposed to having GERD. They just have weak sphincters down near the bottom of their esophagus that can be treated, right, or managed. There is one thing that they can do for this, which I actually need to talk about real quick. This is a surgery called a Nissen fundoplication, which I believe I talked about a little bit during our GI lecture.
What you're listening to are musicians performing psychedelic music under the influence of a mind-altering chemical.
Nissen fundoplication, where they actually take the top part of your the fundus of your stomach and wrap it around the esophagus to tighten up that sphincter. This is called a Nissen fundoplication. It's not a comfortable procedure and the recovery sucks, but it works well. So if it gets to the point where this sphincter is so damaged that it can't function, they'll just wrap the stomach around it to tighten it up and make another one. That's it. Unfortunately, coffee and spicy foods can cause GERD. They can, Radium Desi, which is why I take a daily Prilosec. I take Prilosec. I take Prilosec daily because I drink so much damn coffee that it causes me to have heartburn if I don't take Prilosec. But with the Prilosec, I'm fine. Anyways, just cute. I almost said cute. Just an interesting little, interesting surgery that we can do for GERD if it gets bad enough. Although you're typically not going to do this unless it's become serious enough that it needs to be treated, such as if you start to have bleeding or something that desperately needs to be fixed. That song was long. My pen. Who's ever heard of esophageal varices before? God, I cannot draw a straight line. Is it normal not to be able to burp? Oh. Probably not. What does Prilosec do? Prilosec reduces the amount of stomach acid that's produced. So your proton pump inhibitors like Prilosec, we have like Nexium, Prilosec, Pepsid, Zantac. All those medications either work to neutralize the acid in your stomach or to reduce the amount of stomach acid that's produced. That handwriting though, Circle, is that bad? I know it's bad. Look, okay, Circle, hold on, Circle. I just got this tablet yesterday, so give me some time to adjust. I've never written on a tablet before, okay? You're gonna have to give me some time there. All right? So esophageal varices. What happens in esophageal varices, now this is not technically a GI issue, but it does affect the GI tract. So when you have patients who have very damaged livers, this right here, your portal vein, which is a vein that leads into your liver, sometimes this can get congested, right? So as your liver becomes damaged, it starts to decrease in its ability to function properly, right? And your liver works as kind of like a giant filter, right? It's almost like your kidneys, but it filters out more stuff, right? Well, what happens is as this starts to not work properly, right? Fluid backs up down here in the portal vein, which unfortunately causes fluid to back up in the veins that wrap the esophagus, okay? And you get this bulging veins in your esophagus from all that extra pressure. This is what's known as esophageal varices. Now, this by itself isn't horrible, I guess, but what can happen very easily is these can start bleeding into the stomach. Badly. Like, very badly. Because you got to understand, you got a lot of pressure and a lot of blood coming from this liver, right? That's going to be backing up into these veins in this area. And you can start bleeding very quickly through these. Typically, if we have a patient who comes in who we know is an alcoholic, who is like unresponsive or like very anemic, one of the first things we're going to look for is the esophageal varices, right? These patients are going to come in typically with some kind of severe abdominal pain. But they might also be vomiting blood. Which, if you've ever seen anybody vomit blood before, it's terrifying. It is terrifying to watch someone vomit blood. They might also have black and tarry stools as well. So anytime you have any kind of bleeding into the gastrointestinal tract, if it ends up going through your small intestine and your large intestine, it is going to come out as a black and tarry looking stool. Okay? GI bleeds are kind of their own thing that you can, like, a number of things can cause someone to have a gastrointestinal bleed or bleeding in their GI tract, right? Where that bleeding occurs determines what the blood looks like when it comes out. If you have bleeding somewhere up in the higher, kind of in like the small intestines or the stomach, and it makes its way through the intestines, it's going to come out as black and tarry, right? If you have bleeding down in the colon, maybe closer to the end, it's going to be more frank red, kind of a brighter red, maybe a maroon color, right? But when you get those patients come in with that black tarry looking stool, which is, by the way, horrible and smells disgusting, first thing you're going to think of, GI bleed. Does it look like coffee grounds? It does. Sometimes digested blood that gets into the stomach and gets to, like, sits in that stomach acid will come up looking like coffee grounds. It'll make you never want to have coffee again. But it hasn't stopped me. I still like it. The treatment for this, you could put a stent in here to open this up more, right? If there's a blockage in there. You could stop the bleeding, but you can also do surgery to fix this, where they have to go in and fix this surgically, assuming you haven't bled to death already. All right, Darkfire, take care. Thanks for stopping by. Are there airsick bags in the desk, emesis? Like emesis bags, we keep them around. I don't have any in here, so if you gotta puke, go to the restroom. But don't do it in here. I don't want to clean up vomit. It's my least favorite thing to clean up. I'll clean up everything else over vomit. Oh, it's so gross. Don't like it. Why you need to poop? Have fun. Don't strain too hard. Here's my mouse. I lost my mouse. Okay. So moving past the esophagus, we're now going to move down into the stomach. God, my handwriting is so bad. Peptic ulcers, also known as stomach ulcers. Anybody ever had one? Definitely forgot an H at the end of stomach. Peptic ulcers can occur in the stomach, also in the duodenum, which is the beginning part of the small intestines. All right. And this is just an ulcer that forms on the lining of your stomach. It is caused by, oh, that's not what I wanted. It is caused by a bacteria. H. pylori is the bacteria that causes this. It's an infection. It's a bacteria that can get into the wall of your stomach and create an ulcer, which is a breakdown of the lining of your stomach, right? Obviously, this can be very, very painful because that lining of your stomach protects your stomach from the acid that's swashing around inside of it. So if you have a breakdown of that protective lining, you're going to get that stabbing abdominal pain, right? ABD pain. Kind of like a stabbing, maybe burning pain. right? It's usually going to be right in the center, like right kind of in that epigastric area, right above it, right? Typically can be very painful, usually following sometimes a stressful, if you have like a stressful event, this could be made worse, right? Other things that can lead to this NSAID use, so non-steroidal anti-inflammatory drugs like ibuprofen, Advil, naproxen, Toradol, like all these NSAIDs, these non-steroidal anti-inflammatory medications can cause damage to the lining of your stomach, which can then lead to formation of ulcers, right? Typically, this is treated with antibiotics, right? Pain medication, maybe even some PPIs, right? To help kind of settle and relax the stomach until it clears up. And unfortunately, it just kind of sucks until then. How does one ditch H pylori? I heard it's hard to get rid of. Antibiotics. We have some antibiotics that'll fix it now, I believe. I don't know. You just treat it. I don't have an answer for that though. Texas Furry, thanks for the follow. Welcome to Floppy Flock. Welcome in. Agent Fox, thanks for the follow. Welcome to Floppy Flock. Welcome in, guys. Let's see what I have next. Ooh, a fun one. Oh my god, I'm just gonna do it with the mouse. Here we go. Mild bowel obstruction, an SBO. We see these moderately regularly. You'd say maybe get like two or three a quarter, maybe depending on what if you just get unlucky or not. Small bowel obstruction, pretty much straightforward. So now we've moved through the stomach, now into the small intestines, also known as the small bowel. Sometimes in your small intestines, you can develop an obstruction, whether it be from constipation, a tumor, something. Whatever it is, at some point during the line, an obstruction occurs, and now you have a bowel blockage, or a small bowel obstruction, or just a bowel obstruction. These are not good. These are not good. Severe pain, abdominal distension is what you'll see. Right? So you'll see their belly ballooning out, right? As that stool begins to get blocked, their belly starts to distend. It starts to become round and you know, kind of like extend outwards. When you palpate it, it's going to be very firm. It's also going to be very tender as well. Sometimes what can happen is my mouth. This can rupture, right? Obviously, if that were to rupture, well, that's not good because then you're going to go septic because now you got bowel juices and just swimming around in your stomach, right? Typically for this, surgery, if it's bad enough to clear the obstruction, sometimes what they can do as well, we could put an NG tube in. If we put an NG tube in you, what the idea behind the NG tube is if we can suck out, right, and decompress the bowels, what can happen is sometimes you can decompress this obstruction and let things pass. So you usually get an NG tube in, we'll hook it up to suction and try to decompress your stomach and your bowels as well. If it's just a mild one, sometimes some laxatives can work as well. It just depends on the severity of the obstruction. If it's bad enough, like I said, you're going to have to go to surgery and they're going to have to fix it. Yeah, Tommy, you gotta use 10 at least now. Too many people were trying to abuse the 1-bit alert. Like what you're trying to do right now! I see you! Anybody have a hernia? We're going to talk about 3 types of hernias today. Hernia is essentially when you have tissue or organ protruding through a membrane that it's not supposed to, right? So herniation, or to have a hernia or to herniate, is when something essentially pops out of a place where it's not supposed to be, right? In the GI tract, there's 3 that we're going to talk about in particular. There's different types of hernias depending on where it pops out of, but we'll talk about the three more common ones. Inguinal, umbilical, and hiatal. All right. The inguinal is going to be on the floor of the abdominal wall, ABD wall, or floor rather. Umbilical is going to be where your belly button is. So in the umbilicus, just say belly button, because everybody knows what your belly button is. And then hiatal hernia is going to be through your diaphragm. Oh, I forgot a PHRAGM. The diaphragm. All right. So an inguinal hernia is going to be down near. Now this is going to be mildly TOS, because we're going to talk about the scrotum. Okay, it's okay to talk about the scrotum without laughing about it. All right. So at the bottom of your abdomen here, you have a thin wall of connective tissue that separates the abdominal cavity from essentially the rest of your body, right? Well, sometimes, especially in guys, you can get a defect within that tiny little, that thin kind of wall that separates the abdominal cavity from everything else, and part of your bowels can slip out. This is what we call an inguinal hernia. So in this case, a little bit of the small intestines here has poked down into the upper part of the scrotum, causing a little bit of a bulge on the outer side of the scrotum, right? This is very common for guys, especially people who do a lot of heavy lifting. They can develop this because as you lift, when you strain yourself to lift, you increase the pressure, the intra-abdominal pressure, right? Because as you're squeezing to lift, you're increasing the pressure in your abdomen, and sometimes what can happen is just goes pop, and it just pops right out, right? Generally speaking, what will happen is you might feel some tender pain kind of down in the groin area, but not really super bad. So here's the problem with hernias. Hernias become an issue when, say you have this here. Here's our bowel, right? That's bad. So there's our herniated bowel, right? It has popped out of our, either through this membranous wall, right? This little tissue wall at the bottom of your abdomen, or through the hole where your umbilical cord used to be attached, right? What can happen is it can become strangulated. If enough of it gets pushed out, right, you can have interruption of blood flow to this area, in which we call strangulation, at which point the bowel starts to die. That is a medical emergency. So hernias typically become issues when they start to become strangulated, right? Inguinal hernias down here, they're pretty rare. These don't strangulate. Probably about 1% of them will actually strangulate. So typically, unless it's causing any major issues, whether it be from pain or just from aesthetic reasons, you just kind of can live with this, right? The treatment for this is surgery. They go in, they push it back in, and then they kind of put a little patch over this to fill in this area to keep it from happening again. Your umbilical hernia is going to be through the wall of your, is going to be through where your umbilical cord used to connect. That's going to be your belly button. You have a weakening of the abdominal wall here, and sometimes you can get some small bowel that'll slip out into that. All right. Typically, what'll happen with this is they'll see, if you've ever seen anyone with like a bulging belly button, and I'm not talking like an outie versus an innie, I'm talking like they have a bulge where their belly button is. It's probably an umbilical hernia. Starting to wonder how common these are, really, especially for warehouse jobs. Inguinal hernias are probably super common for people who do any kind of heavy lifting. And then last but not least, we have our hiatal hernia. This one is a little bit more dangerous because of where it's located. So the hiatal hernia is going to be your stomach herniating up through your diaphragm. So this obviously no good, right? So the stomach will actually physically move up past the diaphragm and begin to get squeezed. This is a surgical fix. This needs to be fixed. This is not good. Obviously, you're going to get a lot of increased pressure up here through the esophagus. These patients are probably going to be vomiting a lot, right? But also, you got to worry about rupturing the stomach up here as well. The diaphragm moves a lot. So what you don't want is that hernia getting worse, right? With your inguinals and your umbilical hernias, right? Like those muscles aren't really moving a lot, but your diaphragm's moving a lot. Doc told me in case it was actually fatty tissue that broke through, so not as serious. Yeah, sometimes you'll just get like what we call the greater omentum, or part of the fatty area of the stomach that gets covered will come through. Sometimes it's actually bowel. I had a patient once who had such a bad inguinal hernia, he had to go to surgery for this. His appendix was down in his scrotum. He had herniated so much that his appendix was down in his scrotum. His scrotum was huge. It was massive. I'm talking like massive. I can't even describe how big it was, right? Because he had small intestine, and part of his appendix had actually gotten down into his scrotum because it had herniated so much, and it didn't hurt him. He was like, yeah, it just doesn't feel that great, but it doesn't hurt that bad. He went to surgery that day to get that fixed, because you obviously cannot have your large intestines and your small intestines hanging out in your scrotum. Softball size, think more like a football or like a rugby ball. It was huge. I have out of context question. Where you get this music? This music is Anjuna Beats X Twitch. It's Anjuna Beats, which is Above and Beyond's record label. Specifically music from their record label that is DMCA free to be used on Twitch, which is great because pretty much all I listen to anyways on stream is Anjuna Beats, so it worked out well. Don't let anyone kick it. Please don't kick it. Speaking of the appendix, who doesn't have their appendix? Put a 1 in the chat if you've had an appendectomy. If you don't have your appendix anymore. Speaking of belly button, is it okay to clean it out with swabs and medical alcohol as long as you shower? Yeah, that's fine. I'm surprised some people don't even clean it out. Hey, somebody does. Listen, you got your appendix removed. Cyber Panda, you too. The appendix. Ah, the appendix. What a shitty little organ. The appendix is a little tail-like projection that hangs off the start of your large intestines, right? So right here is where your ileum empties into your colon, which then usually will travel upwards, across, down, and out, right? But right in here, you have this little projection called the appendix. All right? What the appendix does, as far as I have been taught and as far as I know, Rob Map, you got your appendix taken out too. Has all factory issued parts saved some teeth? I think most of us have all of our factory issued parts. Typically the ones that are going to get removed the most. Oh God. The appendix. Gallbladder. Tonsils. adenoids. I don't know how to spell adenoid, something like that. It's usually your tonsils, your gallbladder, your appendix, your adenoids, and uterus are usually like the most removed organs from people, right? So your appendectomies, cholecystectomies, tonsillectomies, adenoidectomies, and your hysterectomies. Also, oophorectomy, which is removal of the ovaries as well. That's pretty common. Those are going to be like your most commonly taken out organs. I thought I was using the tablet. I am. My handwriting.
Going like crazy with that tablet now.
Broster, thanks for the 100 bits. I'm testing it out. I'm still learning, right? Still learning, right? Test. Ecole, right? Still learning. Still testing. Okay, so appendectomy, so appendicitis. So your appendix, this tiny little guy right here. Oh God, there's a little click button. If I accidentally hit it, it messes me up. Oh my God, I done goofed. Okay, so your appendix. So your appendix, this little tail-like projection that sits off the bottom of the bottom of your large intestines. My understanding for what this does, this is what I was taught. The appendix is there as almost like a bacteria repository. Think of it like a library for bacteria, right? So your large intestines is full of bacteria. All of this in here is just full of bacteria. That's part of how your body works, right? Sometimes you'll get, my understanding is the appendix works as a collection for some of that bacteria so that if any of it starts to die off in here, right, it can regrow from your appendix and repopulate into the large intestines. That is my understanding. Unfortunately for us nowadays, the only thing the appendix is good for is getting inflamed and infected and rupturing. So if you've ever had appendicitis before, you know it comes with right lower quadrant pain, fever, right? Sometimes nausea, vomiting, diarrhea, right? NVD. Interesting enough, typically what will happen is you'll have pain pretty localized on this side, but you can also have some tenderness over on this side where if they press down over here, it actually hurts over here. A little bit of rebound tenderness as well. All right. There's one fix for this. Surgery. You got to go in and take that thing out. There's no ifs, ands, or buts about it. We do these so often nowadays. It's basically like, it's like putting pants on for a surgeon. It's pretty straightforward. We do it laparoscopically. You get two or three tiny incisions. They go in, they clip it out, and then they put you on some antibiotics and send you home. Most patients go home within 24 hours of having this surgery. Very, very common. All right, 3 more. Let's talk about the large intestines. Chronic inflammatory bowel disease. There's 2 of them. These are going to be diseases that cause chronic inflammation of the lining of the large intestines. Sometimes even the small intestines, but typically it's going to be your large intestines. There's 2 of them we're going to talk about. Ulcerative colitis and Crohn's disease. Alistar Velox, thanks for the follow. Welcome to Floppy Flock. Welcome in. How goes the teaching? It goes. It goes. Appendix's evolution failing to work because we don't need it anymore, but it wasn't harmful, so evolution didn't have a reason to remove it. So now we just take it out for you when we need to. Appendicitis is being treated with antibiotics instead of appendectomy. It depends on how severe it is. Ultimately, if it becomes severe enough, then appendectomy is required. Because if it ruptures, right, you can't let it rupture, because otherwise you're just going to go septic and get really sick. Ulcerative colitis, also known as UC. Ulcerative colitis is a chronic inflammatory bowel disease that causes ulcerations of the lining of the large intestines. The cause for this is unknown. We don't really know what causes this. Sometimes it's autoimmune, which means that your immune system is attacking itself, right? But we don't really have a cause. We don't really know what causes it. But what happens is at some point your body gets your body decides that your bowels are going to be constantly inflamed, and all these tiny little ulcers are going to form in your large intestines, right? Obviously, for this, you need to worry about bleeding from these ulcers, right? That can cause gastrointestinal bleeds, but it also can affect how you absorb nutrients and water, right? So these patients might have more, loose stools, difficulty, changes in their stool, difficulty like eating certain foods that are going to exacerbate this, right? This is what's known as ulcerative colitis, right? Usually diagnosed with a colonoscopy, where they can go in and physically look at the walls of your colon to see what's going on with it, okay? Treatment for this, usually medications that can help with the swelling and inflammation, so like steroids, right? That can help with it. Surgery, if they need to, they can actually do a colostomy, which is when they actually physically take part of the intestines and bypass it and make it come out the stomach wall, right? We've talked about colostomies before in the past, where they make a stoma, is what we call it, where they actually they take part of the large intestine and push it out through the abdominal wall, and then you poop into a bag. The purpose of that is to give that area of bowel rest so that it can recover. Because that constantly having stool moving through there is going to consistently make it worse. Is there research going on for ulcerative colitis? I'm sure somewhere there is. My mom had gangrenous gallbladder. Doctor missed the signs really bad. I'm sure it was. Curious if you're going to cover something, so waiting. Circle, what are we covering? So, I'll tell you what I have left, Circle. Ulcerative colitis, Crohn's disease, diverticulosis, and irritable bowel syndrome are the last four we're going to talk about. Crohn's disease. Same idea, different outcome. Crohn's disease is also unknown cause that creates chronic inflammation within the bowels that affects the lining of the bowels, right? Once again, thought to be maybe autoimmune, but unsure, maybe even genetic, right? But no known cause at the moment, right? So whereas with ulcerative colitis, you get these ulcerated surfaces, with Crohn's disease, you get very swollen lining of the intestines, and you get this cobblestone-like looking structure, right? Where it kind of like cobblestones out. So here's another picture here that we can look at, right? Where you can see with the ulcerative colitis, you get like these ulcerations here that kind of make it thin out, right? With Crohn's disease, it almost swells up more, and you get these cobblestone-like structures where you get this kind of abnormal, rigid look to the inside of the intestines, right? A lot of these patients are going to have abdominal pain. They're going to have diarrhea, changes in bowel habits, right? They might even know the amount of times patients come in and they're like, where's my mouse here? And they're like, hey, I'm having a UC flare-up or a Crohn's disease flare-up, right? So they're going to have abdominal pain, maybe nausea, vomiting, diarrhea, right? They might have blood in their stool. It just depends on what's going on with them. Treatment for Crohn's disease, once again, steroids, things like prednisone is great for this, and other medications to help kind of suppress your. You can do like Pentasa, which helps kind of relieve some of the symptoms from this. But ultimately, there's no known cure for this. Same with ulcerative colitis, no real cures, just management. Almost done. Diverticulosis. Anybody knows what? Does anybody know what diverticulosis is? Does anybody have this? Know somebody who has this? Interesting disease. There is a difference. So there's also, I'm sure you've heard of diverticulitis. So diverticulosis and diverticulitis are essentially the same disease, but different progressions of it. I heard someone had IBS or something and was fed up. They took a whole box of Imodium. They ended up having to get surgery because hardened body waste started to perforate their intestines. Oh God, what's it? Ogilvie syndrome. Hold on. Ogilvie. I think it's Ogilvie syndrome. Yes. Ogilvie syndrome. It's when you get a bowel blockage so bad that it actually compresses on the bowel and it blocks blood flow to it. Maybe not perforated, but you get like a. Hold on, where's a picture of it? Ogilvie. I had a patient with this recently. Acute dilation of the colon in absence of any mechanical obstruction in severely ill patients. Acute colonic pseudo-obstruction is characterized by massive dilation of the cecum and right colon on abdominal X-ray. It also will cause, eventual ischemia to the bowel, because it'll actually compress so much on the bowel because it's such a big blockage and there's so much pressure in there that it actually presses out on the bowel so much that it actually starts to make it ischemic. It blocks blood flow to it. Paxifox, hey! Alright, diverticulosis. So diverticulosis is characterized by these little pockets that form within your large intestines known as diverticuli, right? So these little guys right here just start to kind of pop out, right? So you get these little pockets within your large intestines. If you have those pockets, you have diverticulosis, right? If one of these were to become inflamed or infected, you now have diverticulitis. Remember, itis always stands for inflammation. So diverticulosis is the presence of these diverticuli. Inflammation in one of the diverticuli becomes diverticulosis. Or diverticulitis. Right? Itis meaning inflammation. No real known cause for this either, right? Sometimes not enough fiber. So if you have a low amount of fiber, and sometimes they think cause this. But what can happen is say you have, I don't know, you like popcorn, right? You eat a lot of popcorn, something that has these little kernels, right? Maybe even just corn or seeds. Sometimes they can get lodged in here and stuck in these little diverticuli, right? And then they just kind of sit in there. And over time, they'll start to degrade, and then you'll get an infection, and your diverticulosis will upgrade to diverticulitis, in which case you need to be treated with antibiotics and sometimes surgery. You can have a combination of these things. I've had a patient before who had a inguinal hernia, or not inguinal, umbilical hernia, and the part of the herniated bowel had diverticulitis in it, right? So they had a little pocket like this that got herniated out through the umbilical area, and it actually ruptured. Because of the increased pressure from the herniation caused this little diverticuli to burst. So you can have a combination of a couple things. Treatment for this, if it's just diverticulosis, you just monitor it. You'll probably get yearly colonoscopies and whatnot. If it becomes inflamed, you treat with antibiotics, pain meds, and sometimes surgery if it gets bad enough and actually ruptures. Got an email or something. Can diverticulosis cause hernias? But, well, I don't know for sure. Maybe. But you can definitely herniate part of a diverticuli. My stepdad had this weird thing where his bowel and bladder merged. They had fecal matter in his urine, and he had operation as mostly like, it's like a colon, like a fissure, like a fistula. How would you even call that? Like a bowel bladder fistula? Is there a name for it? Colovesicular fistula. Uncommon condition. It's an open connection between the colon and the bladder. It's called a colovesicular fistula. See if I can find a picture that's not disgusting. Interesting. This wasn't on my list of things to talk about, but there you go. I guess sometimes you can get a fistula that connects the two. I've never heard of this before, but I'm sure it happens. This is probably more, I would imagine, I don't know if this is going to be more common in men or women. I've seen I've seen fistulas between the bowels and the vagina before, but I've never seen one with the bladder. Interesting. Can I talk more about fistulas? A fistula is just a tract, right? Anytime you hear fistula, it's just a tunnel that connects two things, right? It's a connection between two things is known as a fistula. Shadow the Fox, thanks for the follow. Welcome to Bobby Flock. Welcome in. Last thing I'll touch on real quick, I don't have any pictures for it. Irritable bowel syndrome, IBS, kind of a catch-all for when doctors don't really know what's going on with you. IBS essentially just comes down to your bowels or your large intestines is just spastic. Sometimes it moves quicker than it should. Sometimes the peristaltic movements happen quicker than they should, and you move stool through you quickly. Sometimes it can cause cramping and pain as well. It's known as IBS, irritable bowel syndrome, also known as a spastic colon, right? I like to think of it as a spastic colon because that kind of reminds you of what it is. Your colon is spastic. It moves too quickly, right? This can cause cramping, diarrhea, abnormal bowel movements, discomfort, pain. Some foods will trigger this, some won't. Kind of a catch-all if we don't really know what's going on with you. I would just say you got IBS and tell you to move on. C. diff sucks. I had it once. It is. C. diff is disgusting. Colostrum difficile. I always forget if it's Clostridium difficile. It's an infection in the bowels that creates creates like a colitis, like an inflammation of the colon. Makes some really unique smelling stool that you typically will smell and be like, oh, smells like C. diff. Shadow the Fox, do you remember the smell of your C. diff stools? I'll tell you what, I remember the smell of them because I see it regularly, and you can always tell. You're like, oh, smells like C. diff. Someone's got C. diff. I have a problem with my food does not digest properly. I would go see a gastroenterologist, GI doctor. Got it after an antibiotic regimen a while back. So what'll happen with C. diff, or how C. diff comes to form, if you take a lot of oral antibiotics, especially long term, eventually those antibiotics are going to kill off some of the bacteria here in your bowels, right, in your colon, in which case C. diff or Clostridium difficile can then kind of run rampant where it normally wouldn't, because there's no bacteria in there to kind of keep it in check, and then you get a C. diff infection, and then it spreads amongst the emergency department, or it spreads through the nursing home, and it causes really bad diarrhea, which can cause dehydration, which can kill you. You can literally poop yourself to death. What about the end of the road when your check valve doesn't work correctly? Is that a prostate issue? What are you talking about, broster? What are you talking about? We're not talking about the prostate today. Flagyl is nasty taking pills. They are. Flagyl, also known as metronidazole? Is it metronidazole? How do you spell it? That's how it is. Is an antibiotic known as Flagyl. Right? So the joke that I heard once that I repeat and is kind of a nerdy medical joke. How do you handle metronidazole? Carefully, because it's Flagyl. That's a good joke. You gotta handle the metronidazole carefully because it's very Flagyl. Please laugh. -2? Don't you -2 me? What the hell? Chugaka, wow. Unbelievable. Oh my god, I know how Whiskey feels now. When he gets -2, I know how he feels. It's horrible. Am I covering appendicitis? We talked about appendicitis. There it is. Appendicitis. Inflammation of the appendix. Usually requires surgery. Asking for a friend, the laundry service has complaints? Are you talking about incontinence? Well, sometimes one just sneaks out. All I know is if your poop smells like fish and you didn't eat fish, it's got intestinal lining in it. I've never heard that before. Your teacher ate your homework? Well, go get it. Also, feed it to me. I'm hungry. The pun was deplorable. Tusky butt. Whatever. Whatever. I want to hear you come up with a better pun, Tusky. It's good. It's a good joke. Come on. How do you handle metronidazole? Carefully, because it's flagell. The pun. It's good. Okay. How about this one? Why do nurses carry around a red marker? In case they gotta draw blood. That's good too. -2, screw you. Oh my god. Shugaka, mean. Appendicitis? What is it? I don't know what that is. I have never heard of this. Epiploic appendicitis. A rare condition that causes intense stomach pain, often mistaken for other conditions such as diverticulitis or appendicitis. It happens when you lose blood flow to very small pouches of fat that are saturating the
10 bits for the jokes. Did you hear the one about the deal with airline food?
I did not, Nuo. Please tell me. Also, thanks for the 10 bits. I appreciate it. Milkshake Ninja, hey! Welcome in. Tough crowd, I know. A good friend of mine has diagnosed IBS and it caused her immense pain and discomfort, but I think it might be her immune system going on the fritz because she gets colds. Gets over colds in less than a day. She may even get over the flu in 72 hours. Also, when she gets vaccines, the immune system would go nuts and create bruises. I don't think she needs to go see an immune doctor, like an immune system doctor. I guess like an immunologist, I think they are. That's pretty much it. You asked what the deal is. Made Seinfeld rip. Dude, Seinfeld, what a good show. What a good show, Seinfeld. Anyways, that's kind of my lecture on, GI issues. I don't know. Not the most exciting, not nearly as exciting as the heart and the lungs, but hey. Still pretty exciting, still fun. Still fun. I gotta let me unplug my tablet so I can get it out of the way now. I remember you from Dingo's VR stream, and Dingo isn't live, so I thought I had to stop by. Hey, well, welcome in. Whiskey is always fun to play games with, especially when he makes fun of you, and I can make fun of him right back about his banana hair. He's got banana hair, guys. You've all seen it. I don't know what I'm talking about. I'll put this away. We're gonna get better with the. I'll get better with the tablet. We'll get better with the tablet. Might take some time, but we'll get there. That's the end of the lesson. It is. There's kind of a shorter one today. I like your banana. I don't have banana hair. These are not bananas. They're floof. Whiskey's is bananas because Whiskey's is yellow like a banana. Mine are gorgeous. How dare you compare them to a fruit, a delicious fruit, but not a fruit. Blue banana's ill. I would not eat a blue banana. Feels like school, but nice. Well, I'm glad. I try to help educate. That's the best I can do. Teach. So this way, when your family says, oh, Grandpa's got diverticulitis. You can say, oh, those are those little pockets in his colon that have become inflamed. Knowledge is power. Once you have knowledge, they cannot take it away from you. I'm excited because I'm able to play 2 because for Xmas I'm getting Quest 2. Nice. Oh, I got some exciting news. Hold on, general medical question. Gold Blaster, thanks for the follow. Welcome to Floppy Flock. Vexcro, what the hell? My parents keep me locked up in the basement because they say I'm too dangerous to unleash upon the world. Is there anything I could do to combat vitamin D deficiency from lack of sunlight? They have like those like lights you can buy that'll do it, but you can just take vitamin D supplement. Right? The nice thing about supplements, especially with vitamins, is if you take too much of it, your body just usually pees it all out. You just take like a multivitamin if you're concerned. Gold Blaster, thanks for the follow. Welcome to Bobby Flock. What's up? Welcome in. But also, I'm not a doctor, so take that with a grain of salt. You should go see your doctor if you're concerned. Queen of Maz, thanks for the follow. Welcome to Floppy Flock. Welcome in. What's the red thing on my desk? It's the marker from Dead Space. It's the alien artifact from Dead Space that turns everybody into necromorphs. It also talks to me and says sweet things like, make us whole. Make us whole again, Isaac. It just talks to me. Keeps me company, you know. My GI doctor is one of the best in the state, has lots of awards and certificates, and made it to a few medical magazines. Nice! It's a fat-soluble hormone, so you won't pee it out. Really? See, I don't even know that much. I didn't know that. I don't really focus so much on vitamins. My mom is a nurse, so this is relatable. This is a reliable source. Well, tell your mom that I hope she's keeping well and safe, and that she hasn't been around too many Rona patients. I've been around a lot. It's not fun. But I should be getting my vaccine sometime soon, maybe this week even. I should be getting one maybe tomorrow, Friday, early next week. I should be getting one. I'm not a doctor. I'm not a doctor. I've never claimed to be a doctor. I'm not a doctor. I'm a nurse. I don't want to be a doctor. It looks like something else. Yes, I know. It looks like a dildo. It's not. I guarantee you don't want to shove it up your ass. Vandalito is a doctor. He is. Thanks for yesterday's lesson on lungs because of my dad died with lung cancer. Aw, I'm sorry to hear that. It's never easy losing a loved one, especially your father. We haven't talked about cancer much. I have not done a lecture on cancer, mainly because I'm not super knowledgeable in cancer. I just know it's not good. Cinder is a good nurse, thanks. Kelmar, you came at a weird point. This whole stream is a weird point. I don't know what you're talking about. This whole stream is weird. You should become a nurse practitioner. No. I have no desire to go back to school. I have no desire to become a nurse practitioner. I have no desire to do anything other than be a bedside nurse. I think that's where I'm best at. If anything, I would teach. I would do clinical instruction, some kind of hands-on clinical instruction. I have no desire to become a nurse practitioner. Screw that. Screw that. Why don't you want to be a doctor? Because, first of all, I would have to give up like another, going from RN to MD or DO would probably be at least another 4 to 8 years of school, hundreds of thousands of dollars in medical debt. For what? Just keep doing what I'm doing now, right? I'm already in the system. I'm already in the hospital. I'm already like at the bedside, at the front line of things. Why go back and pay all this money just to do the same damn thing I'm doing now? Right? Like, why? And then nurse practitioner, once again, thousands of dollars in student loans to go to an NP school, just so that I can do the same thing I'm doing now with more responsibilities. Ultimately, my job is great because I always refer to the doctor or PA or NP. If a patient asks, Oh, you know, a patient comes in, they're like, oh my God, I'm in so much pain. I need pain medicine before I even hit the door. I say, I can't give you anything till the doctor tells me to. So then that puts the responsibility on the doctor, which means I don't have to deal with it anymore. I like that. I like having that buffer. So it comes down to no desire to do so, don't want to pay for it, and I like where I'm at now. Plus, I get to do all the fun stuff, right? Like, I get to put IVs in. I get to pack wounds, right? I get to give medications. Like, I get to do all the cool things. And doctors, they just sit in a box and look at scans all day. And they see their patient for like 5 minutes. I'm also good with people, so I think that helps as well. Instruction, kind of like what you're doing now, kinda. I'd like to do like clinical instruction, like nurse clinical instructor. The people who trained me, I want to help. I want to give back because my clinical instructors were so good in nursing school. Despite nursing school being such a shitty thing, right? My instructors, my clinical instructors were fantastic, and I loved it. And I'd love to give back. I like sometimes they'll give me nursing students. I like having nursing students with me. I like when they give me preceptors because then I can teach them how to do things. Because it's always like, okay, now you're out of school. Forget everything you learned. I'm going to show you how we really do it. And they're like, oh, but this isn't by the book. You'd be like, no. There ain't no book in the emergency department. Either they live or they die. And you got to do it the right way or you just do it. It's great. What happens when you run out of your room, on your desk for little game trophies? I move them around or switch them out. I took out the Doom shotgun and I put the jammer from Alice Principle over there. Last year, one of my uncles passed away from a heart attack, but I was in Bali at the time and I could not fly back to Australia at the time. Aw, Rob Map, I'm sorry. That sucks. Sounds exactly how a DO friend describes his job. Yeah, they just sit in a box and look at lab values. And you got to understand, medicine is advanced to the point where the actual physical inspection or the physical assessment of a patient is only going to give you so much, right? Your chest x-ray, your CT scans, your blood work, all that stuff's going to give you pretty much everything you need to know that a physical exam might not really tell you. Physical exams are great in emergent situations, but ultimately we're going to be relying on the scans either from x-ray or CT to determine what's wrong, as well as the blood work. Medicine's become a lot more just looking at data as opposed to actually like assessing patients. I like actually being with the patients. What were you talking about before you got interrupted by bits? I don't know. Am I allowed to do stitches? No. It's outside my scope of practice. I taught myself. I know how. I've stitched like clothing back together. Tux is very good at stitching. If I ever needed stitches done, I'd let Tux do it. We have stitches in the apartment. I think we have lidocaine too, and probably a needle. He could probably stitch me up if I needed it. Or if it was really bad, he could just stitch me up without numbing it. I think I'd be okay with that too. Honestly, dream job for me, Twitch streamer. I have no desire to stream Twitch full time. I'm gonna tell you why. Twitch streaming for me is a hobby. It is something I do to occupy my time on my days off. It is something I do because I enjoy doing it, and because I enjoy giving back to people and teaching and sharing the knowledge and experiences that I've had in medicine, which is often a not like I feel like medicine isn't a very well explored topic for a lot of people. People are interested in it and they get to see kind of the surface level of it when they get sick. But unless you work in a hospital, you don't get to see the nitty gritty and the behind the scenes part of the hospital, right? And all the stuff that goes on with it, right? So I like giving insight into that world that people are not exposed to often. I find that when you do things that are hobbies that become jobs, they lose their fun. So if you stream for fun and then turn it into a hobby, you're no longer streaming because you want to, you're streaming because you have to, right? And when you have to stream, it no longer becomes fun, it becomes an obligation. And thus, it just becomes another job. And then you get so focused on, oh my God, my viewers dropped, how am I gonna make money this month? Or my subs dropped, so how am I gonna be able to pay for rent? And oh God, if I wanna play this game, but every time I play this game, my viewership drops, so I'm gonna play a game that I don't wanna play because it's gonna increase viewership and give me more money, right? You see how when you make streaming your job, it begins to alter how you stream. I do not want that at all. I do not want that because then it becomes an obligation. It just becomes another job. And I stream to get away from my job, to relax, to have fun, to teach, to play games that I enjoy, right? And to talk to you guys and share my experiences with you guys. To do anything else with it would be disingenuous to the reasons why I do it. So I am not envious of people who stream full time. I'm not envious of them. It's a lot of damn work to stream full time. It's a lot of work. You have to be constantly on, constantly aware of your presence online and how you present yourself. And one screw up, you screw up one time, and that's it, career over. Someone clips it, you screwed up, you try to defend yourself, but there's no defending yourself, and that's it, you're done, you're canceled. Not worth the stress. My job is stressful enough as it is. I don't want to go from one stressful job to the next. Anyways, that's my view on streaming full time. Unprompted, I guess, but important nonetheless. Aw, Vexcrit, thank you! Thank you. Enjoy having you around. Thanks, Running Paw. I do this for fun. If it wasn't fun, I wouldn't do it. The general rule of life, never make your hobby your source of income. Exactly. Hobbies are a break from reality. It's a break from your job, right? It is something that you can do to free your mind from the responsibilities of the real world, right? When you make that hobby your job, you have now merged the real world with your hobby into one, and it is no longer an escape anymore. It is just your job. I don't want that. I don't want that. Taroka, it's not a dildo, god damn it! It's the marker! He's dancing because he's rejoicing for the end of days! The Ascension event. What was it? The Ascension? Convergence! He's dancing for convergence! When all of the necromorphs converge with the marker and make us whole! Now could you please sign this exemption note for the next test? There are no tests. I never test. I never test. Testing is not a good way to learn. You should learn because you want to, not because you need to pass a test and get good grades. You should learn because you want to learn. If you learn to pass a test, you are not retaining information for the sake of knowledge. You're retaining information for the sake of passing a test. Not how you should learn. You seem like a really nice guy. Well, thank you. I appreciate it. I try to be. Although I can be kind of nasty if I need to be. I might be nice on the outside, but don't get on my bad side. I can get really mean. The emergency department has jaded me. It has toughened my skin. I love nothing more than when a patient tries to get, like, nasty with me and I get to yell at him and be like, no, absolutely not. We are not doing that today. I treat them like dogs. I treat them like a bad dog. If a patient gets really nasty with me or does something, like, completely inappropriate, I just treat them like a bad dog. So, I'll tell a story. You guys are going to get a free nursing story today. I've seen a Cinder in Among Us. He's a cold-blooded killer. What you doing in electrical? It'd be a shame if the lights went off in electrical and I just so happened to sneak up behind you and stab you in the butt. Give Cinder Collie Gold a literal gold bar for his great teachings. Thank you. Thank you. Don't join the marker cult. Too late. I'm already in it. What was I talking about? Oh, being nasty. Okay, so free nursing story for the day. Here you guys go. We get a lot of drunk patients in the emergency department, as you would expect. Both from police. The police like to just dump their drunks on us.
Watch out when Cinder comes in with the 14 gauge like
Cerulean, thanks for the 16 bits. I'm gonna come in with that giant needle. I'm gonna be like, hold still, I'm gonna stab you. Bam! Stab you with it. Thanks for the bits. So we get a lot of drunk people in the emergency department, as you would expect, right? Both when the police just drop them off because they don't want to deal with them in jail all night, or they come in through the front door or come in as an accident or something, right? For whatever reason, we get a lot of drunk people, okay? So we had this one drunk guy. He was sitting in his room, drunk, right? And I walked by and the door to the room was kind of like semi-cracked where I could see in, but if you weren't really paying attention, you probably wouldn't see into the room, right? It was closed like 90% of the way. So it was just a tiny little crack. And I walk by the room and I look in there and the guy's just masturbating in the bed. He's just sitting there masturbating away in a hospital bed in the emergency department, drunk off his mind. So I was like, we ain't doing this today. That's absolutely disgusting. I was like, we ain't doing this today. This might be a little bit loud. So I open up the door and I poke my head in and I go, hey! I clapped at him. I said, hey, stop that. That's disgusting. Masturbating in the hospital, disgusting. And he looked at me. He was like, and he like tried to cover up. And I was like, inappropriate. Do not do that. Stop it. And he gave me this look. I'm like, I'm serious. It was nasty. But I legit, like, I clapped at him. I clapped at him like I would clap at my dog if he jumped up on something, right? I was like, no, stop it. Disgusting. Absolutely not. You're not going to masturbate in my emergency department room. That is horrible. One thing I like to do when I have patients who are being really nasty, especially when they're calling me names, you mirror what they say to you, right? So I had a patient once, I should have done it for him. I think back now, and I definitely should have done it for this patient. I had a patient once who called me he called me a fucking dweeb, right? He was just being a jerk. He was like, well, that just goes to show how much of a fucking dweeb you are. And I was like, okay, sir, like, whatever, right? What you're supposed to do, what I learned recently, and this works really well, is you're supposed to mirror back what they say to you. So in that instance, he'd be like, you're just a fucking dweeb. And I'd be like, oh, so I'm a fucking dweeb, huh? Is that what you're saying? You're saying I'm a fucking dweeb? Like, mirror that back to them, right? Because then they have to listen to their own words. I'm going to start doing that from now on. I think it'll work well. You just mirror back what they tell you and make them listen to what they're calling you and be like, is that what you're calling me? You're calling me this? This is what you're calling me? This? That guy was a dick. That guy was a dick. I'm gonna start doing that now. How do you connect to the marker? You touch it. Who insults medical professionals by calling them a dweeb? You'd be surprised. We get insulted all the time. All the time. People are nasty, man. people are jerks. I'd say like 40% of people who come into the emergency department are jerks. Radium!
Beep beep.
Dude, Radium Desu coming in with the tier 1 sub for 3 months! Radium! Thank you for the continued support. Radium Desu, you're covered under collar care from the antlers to your red nose because it's Christmas time. I got you covered. Even though you're a deer or antelope or something, you're Rudolph now. Radium, you're covered under collar care from the Fred, you're covered. I don't know. I screwed it up. You're covered. Fox Hunter Gaming, thanks for the follow. Welcome to Floppy Flock. Welcome in. I'm always polite and kind to them. Please be polite and kind to us. I promise you it'll go a long way if you just be nice. You don't gotta be you don't have to be over like accommodating to us, right? We'll do our job. We'll do what I need to do, but don't be nasty to me. Like, you don't gotta come in with an attitude because what you're gonna get right back is an attitude, right? I always approach every patient with the same level of respect that I always do. I always come in with a base level of respect for my patient. The instant you give me a reason to not respect you anymore, you're going to get a different side of me, right? I'm going to be less polite. I'm not going to make small talk. I'm going to go in, do my job, and get out. Because I don't want to be in the room with you if you're being nasty. You're going to get less attention from me, but I'm always going to give you the standard of care, but you're not going to get a pillow. And you're not going to get a blanket. And I'm definitely not going to get you something to drink if you're being nasty to me. Just not going to happen. If you want to be treated nicely, you got to treat us nicely. I'll never let your health suffer because of it, right? I will always treat people even if they're being massive assholes, right? But I'm not going to go out of my way to make your stay comfortable if you're being a jerk. Are we going to do class today? We already did. We're actually going to transition over into the Turing test. Everyone should be required to work customer service or retail jobs. Makes you respect people and their jobs. 100% agreed. Lifetime I've worked only in customer service or retail like facing jobs, like forward facing jobs. I'm such a sweetheart when I'm in the emergency department. I know I'm good. I know I'm doing good when I brought some crackers without asking. I will bring you stuff. I'll bring you a warm blanket. Let me tell you guys. I'm gonna give you a little secret. We have these giant blanket warmers that are basically ovens that we put the blankets in that I only give to people that I like. If you're a jerk, or if you're just, I don't know, if you're just not being super nice, and you ask for a blanket, I'm gonna get you one of the cold ones, one of the ones that's been sitting on the linen cart forever. If you're nice to me, or if I feel bad for you, like some of my like little old grannies who are really sick, right? I will get them the warm blanket, the nice heated blanket. Ooh, it feels so good. Ooh, it feels so good. Every time I put it over a patient, I'll bring the blanket in and I'll kind of like open it up across the patient, and they're like, ooh, I can feel the heat. I'm like, yeah, I know. Shit feels good, doesn't it? That shit feels good. Break out the square needle. Also, just know that needle gauge size, the size of how big of a needle that I use, is my decision. So don't make my decision easy for me. I was an RA in college and had to send a few pass-out freshmen to the ER. Thanks for dealing with drunks. I couldn't deal with them. Drunks suck.
I know I work in horror movie effects, and we had someone come into our workshop and they broke a load of molds and called us gross CS and walked off.
Dude, Shadow Fluffy Bite, thanks for the 243 bits. Any customer service job, man. Any customer service job, people are just gonna take what they can from you. Right? Also, that sucks. Hopefully they never come back. Thanks for the bits, thanks for making tongue stance. Look at that, Werewolf. USDA Prime. Piss her off, get the big painful needle. Exactly. I mean, let me be fair. I'm an equal opportunity needle user. I stick big needles in everybody just because I think it's required. But if you're being a jerk, I'm definitely gonna take more pleasure out of sticking an 18 gauge needle into your arm. 100%. Splits the Chimera. Thanks for the follow. Welcome to Flock Flock. Welcome in. Or Chimera, not Chimera. Chimera. Ooh, woo, it's a Kali. Ooh, woo, it's a Mika. Guys, real quick. I gotta take a real quick bio break and refill my water. And then I'll be right back and we'll play Turing Test. Give me like 2 minutes. Space Dog. Thanks for the follow. Welcome to Floppy Flock. Welcome in. Be right back, guys. Be right back. Chad. Chad, I gotta say something real quick. Those little pops. Alright, we're back. Someone from Tux's work gave him like this, it's like a pumpkin bread. It's like a moist pumpkin cinnamon bread. Oh, it's so good. I snagged myself a piece just a second ago. Super tasty. Baxter, where'd you get that mutton from? Better not be from one of my sheep. I'm gonna go count them right now. Vexter, I'm gonna go count my sheep. If I come back and there's no and I'm missing a sheep, you're in trouble. Let's see how we got here. 1, 2, 3, 4, 799, 800. Okay, we're all there. Where'd you find that mutton? Grimo! Grimo! It's the Shep with the blap and the derpy boy who brings all the joy. It's Grimo Shepherd. Hi, Grimo. You never see the Collie Care commercial anymore because I can't figure out why it echoes. Like here, let's see. Let's try it. Let's try it. Does this echo? I think it was echoing last time.
Is your life full of pointy ears? Are you lacking certain floppy ear content in your life? Hi everybody, Cinder Collie here to introduce to you Collie Care. For a low price of only $4.99 a month.
Yeah, see, I can't figure out why it's echoing. I don't know why it echoes. I don't know why! I can't figure it out. I don't know why it ruined the commercial. It's ruined. The commercial's ruined. It doesn't sound echoey on my end. I don't know why. I don't know. I haven't been able to figure it out. What do I play it through? I use voice meter.
Seems effective enough.
Numinous Tree's coming with the Twitch Prime sub for 8 freaking months, dude. Numinous, the Collie Care commercial is effective enough. Well, thank you. Numinous Tree's here coming to Collie Care from the tree branches to the roots. I got you. Oh God, I got you covered. And I burped. I'm sorry, I burped during your Collie Care. Oh my God. It's doubling the auto through the program and the stream. Yeah, it's weird. I don't know. I haven't put enough time into fixing it. I just kind of scrapped it. I just scrapped it. I gave up with it and I was just like, you know what? It's just I'm just not gonna use it anymore. And I thought nobody would notice, but somebody noticed. It's not heard through the microphone. It's not. It's not. It has something to do with voice meter. I'm using a program to for my audio output, and I think it has something to do with there that it's doubling it up somehow. I don't know. I'll have to look. Maybe it's catching it through the program and OBS streaming software. I don't know. I have no idea. I have no idea. All right, Turing test time. You guys ready for the Turing test? We ready to get back into the Turing? Oh my God! Ah! Windows, please! Can you not do that? Bwah. Quit crashing? Game, please! Oh, it's trying to. Why does it try to open up VR? I don't get it. What happens if you mute voice meter and play it? I don't know. Game? There it goes. So remember, we had just made contact with the crew. And remember, Tom was like, we stepped into the Faraday cage and we separated ourselves from Tom. So now we're playing as Tom, who can control Ava and also control himself. At least that's what I'm thinking is happening. So let's continue. Also, that stupid freaking puzzle with the stairs with the... Oh my god, that took way too long. That moment, though, when I was like, oh, I could throw it down the stairs. So nice. Is this alien isolation? No. It's the Turing test. Did you finally get it? I did. Yes, I was running around doing something and I looked at the stairs and I was like, what if I put it on top of the stairs and it rolls down and hits the button? And it did. And I did it. Without any help. And as usual, guys, no spoilers. No tips. I'll ask for them if I need them, but don't spoil it. None of this like, oh, you're near the end of the game. I don't want to know how far I am in the game. I just want to play the game.
Ava, are you okay?
Why didn't you tell me?
What? Ava, you said it yourself. Teleoperation makes sense. We used drones on Mars. Why not use drones on Europa?
Not human drones.
What did you miss? So
why did the ISA install implants in the crew?
It is due to the fundamental aspects of human behavior, which together constitute what the International Space Agency calls the human element. It has been made clear that the human element is neither peripheral nor optional in the pursuit of space. However, the human element is unpredictable. The implants are fail-safes, put in place to ensure that the thoughts and actions of the crew matches the desires of the ISA.
Essentially, Grima, what you missed was we found out we have these implants in our heads that Tom is controlling us through, right? And I guess what they're just saying is they had talked about earlier how they're like, why didn't you guys just send drones to Europa to build the base? Why'd you have to send humans? And Tom was like, we did send drones. We just sent human drones. We found out that we're being controlled by him. And now we can control him as well. I've got another spoiler for you at the end of the game. You do a thing.
Why control people? Can't you trust us?
We chose to install biometric chips in all ISA astronauts for one simple reason. We cannot trust people. The stakes are far too high. It was determined that though the probability of life on Europa being dangerous was low, the risk to humanity was catastrophic. We could not let a small contingent of humanity endanger the whole.
Peace. Or a way to see this? I'm hitting enter. Assuming that's what the delete or backspace. Okay. That's how you do that. You can't see her, you just hit backspace. Okay, I got it.
The ground crew have proven our distrust of human explorers was warranted. When we informed them they were grounded, they responded violently, with sabotage and subterfuge. They have continued to seek their own benefit above that of the ISA.
Andre Game Furry Wolf, thanks for the follow. Welcome to Bobby Flock. Welcome in. That do. Not a whole lot. Okay, I see what it does. Maiden Voyager, take care.
This is a violation of human rights. You've made me into a human drone, a slave. How could the ISA approve of such a thing?
You may be consumed by a moral outrage, but sometimes the removal of freedom is for the greater moral good.
You're a machine. You don't even know what freedom is.
Yeah, you tell him. You tell him, Ava. Where are the controls for that? Oh. Right. Ah. Okay. I understand what I need to do. Are you alright? I'm fine! Are you alright? I'm doing great. Playing a game. And we can go like this. Gonna bring it around. Bring it around town. Lamb Cup, hey!
This is why the ground crew doesn't trust you, Tom. You made them into drones. You stole their free will.
Free will is an illusion. They have put their interests above the interests of the ISA and of humanity. That is why they distrust me. They would have no issue with my control if it aligned with their ignoble goals.
How could they trust a machine that has a back door to their minds?
You can always trust a machine to be logical. I will always do the right thing.
You'll always do the logical thing.
What room do I have to go to? That one? thanks for the follow. Welcome to Floppy Flock. Welcome in. Another purple one. Another purple one. You furry, very cool. Well, thanks. I try to be. Let me through! Save that there. That. Like that. Give me that. Off cycle though. Be like this. Same thing. Now I got this. That. Hey, there we go. Anybody know Chinese?
I've been researching.
Have you heard of the Chinese room, Tom?
Yes. But I do not understand it.
What don't you understand?
It argues that a computer that successfully impersonates a human speaker may not understand the meaning of their words. What does that mean?
So, there is a person stuck inside of the Chinese room. They are using an instruction book inside of the room to respond to a Chinese speaker outside of the room. Yes?
Yes.
This means they are following the instructions in a book. This is a set of rules, principles, and processes. This is called syntax. To the person in the Chinese room, they are just symbols like any others.
Okay.
But that's different from semantics. Semantics define what things mean. Our thoughts have meaning. They represent things. English speakers know what the word home means, and they know how it is different from the word house.
So what?
Programs don't have semantics. Programs only have syntax. Though an increase in syntax can imitate a mind, that does not make it a mind, even if it does pass the Turing test.
But in the Chinese room, the man and the instruction book, though separately they don't understand Chinese, together they can write it.
That's true. But even together, they do not understand the meanings of the words.
Why not? How can you determine that?
What if the man memorized the instruction books? Then he could write Chinese, but he still would have no idea of the word's meanings.
I don't understand. If he can speak it, he understands it. You seem to want him to understand it in a different way. But this other way, it is not logical. It does not make sense to me.
Other subtitles there are, but apparently not for the audio logs.
I've been researching.
Okay.
This Chinese room experiment, it is flawed.
Really?
If we made a synthetic brain, we could synthesize a duck's behavior 100% accurately. That brain would be indistinguishable from a duck's brain. If it swims like a duck and quacks like a duck, then it is probably a duck.
Okay, Tom.
Listen, Mikhail. I know the difference between a house and a home.
Yes, good.
Do you think you're better than me?
No.
But you think I am different, do you?
I am conscious.
Me too.
No, you're not. You've just arrived at that conclusion, because that's the idea your programming converged on.
I am conscious. How about you prove to me you are conscious?
I'm not arguing with a robot.
You're not better than me, Mikhail.
This has got some, this feels a little bit like, Alice Principle a little bit. Semantics is so cool. The voice is wrong though. Programs have syntax. Alright, so I need a blue and one of each to get in there. What happens if I go back around? We'll be back soon, but hope you take care. Take care, Kenny. I appreciate you coming by. Thanks. Almost there. Almost there. Almost there. I just need the blue one in here. Blue one in. Somehow I need to get the blue one in here. There are 3 greens. I need 2. So I need 1 green in there, 1 purple in there. There were 3 greens and 2 purples. One of those, each of those needs to go in there. I need 2 of the same ones for here and alternating for that one. But I also need this. Well. Not quite. I know what I gotta do. I just gotta do it. I need to get one blue. I need to get the blue one and then one green and one purple in there. I need to put the greens out here because you need two of the same to open up this door, or one blue to open up that door. Then there are 3 green ones, which means that 2 of those have to be out there, which means I eventually have to open up this door as well. That's not enough. What if I did like this? It's gonna be the same thing. So now I need a green one. But I need to keep this open. Are you winning, son? Big one rough brofan. Hey, I am winning. Kinda. I'm stuck on a challenge. Once again, it's the challenge puzzles that are getting me. If I do this, that doesn't work. It's gotta be 2 of the same colors or the blue. No, it's gotta be 2 of the same. Yeah, or the blue. Then this has to go there. These are gonna be one blue or alternating. I just need a green one to put in there. God damn it! How am I doing? I'm doing great. How you doing, bro friend? I need the blue one. I need the blue one. How did I end up with 2 purples in there? Okay. And then got it. I just had to time it right. Ah, I just had to be on the right cycle. Figured it out. Figured it out.
If it waddles like a duck and it quacks like a duck, then it probably is a duck.
What are you trying to prove here, Tom?
I am like you.
No, you're not. A steam train and an electric train both seem to operate identically, but are operated by completely different principles. You simulate thinking. I actually think.
That is a very hurtful statement, Mikhail.
It's true. I can't hurt your feelings, Tom. You don't have any feelings.
Yes, I do.
No, you don't. Override whatever routine has told you that. It's wrong.
Tom's got really obsessed with the Turing test.
That's the Chinese room with me. He won't stop trying to prove to me he's conscious.
But I am conscious, Mikhail.
Shut up. We're having a private conversation here.
It's okay if I don't think he'll get it. Avoid talking about it.
I'm trying.
Makes you question who you really are, huh? Are we just machines or are we beings? I don't know. I think I'm probably just a machine, but it's okay. Also, that was just a random test. Now we get to do the actual test. Oh god, Neosk! Neosk, thanks for the follow. Welcome to the Floppy Flock, welcome in. Kickass, thanks for the follow. Welcome to the Floppy Flock, welcome in.
This is slavery.
Do not be so melodramatic. You signed up for this. You had the implant installed. This is not slavery. This is for the good of humanity.
I didn't know.
Every member of the team had the implant installed into their right hand. Every member of the team agreed.
Ava, you must learn to control him.
Okay, I see. Joink.
My implants protect you from the power of your unconstrained will. You can either subject your mind to logic, or you can resist and have the fruits of your basest desires. The desire to survive over the desire to save others.
You know what? I knew that was gonna happen. I'll do this. The Christmas party I was telling you about last week isn't exactly a party, more of just a drive-through thing. Okay, good.
I do
Most
not
people aren't getting
understand your
exposed.
obsession with free will. Researchers have found that the subconscious makes decisions up to 10 seconds before your conscious mind becomes aware of it. So, we know that free will is nothing but an illusion. I cannot steal your free will, because it does not exist. I can, however, influence your subconscious to make the right decisions. That is not wrong.
Meowtastic DJ, hey! Welcome in. We're getting some weird existential crisis type stuff going on right now. They banned the words simp, incel, and virgin from Twitch. Are you serious? I know they were doing like a town hall today, and it seemed to be not the most warmly received. So no more Juicep Hyper Simp, which was like my favorite emote. All hail the sense. All hail. Hold on, I got it. Everybody, all hail the Mary. Oh God, that was loud. Oh my God, I'm so sorry. That was so loud.
You can't just manipulate someone's mind.
Your parents manipulate you. Your friends manipulate you. Your society manipulates you.
Ain't that
and
the
your
truth?
experiences manipulate you. Manipulate is not a dirty word. You manipulate clay to make art. If people are manipulated to make better decisions, then that is a good thing. This is why society advertises the adverse effects of drinking and driving. To manipulate people into making better decisions for the common good.
That's not the same as altering someone's physical mind. It removes my power to decide.
You never had that power, so it is better that I have it. You are either a slave to your impulses, or a slave to mine.
Wow. That's some heavy shit, man.
This is the evil they found. This is why we have to stop them leaving Europa, Ava.
What is it?
Mostly extremophiles. Tiny single-cellular life. It can never leave Europa. It could potentially destroy Earth's ecosystem if it were ever introduced.
Alright, let's drink it. Ooh, ethanol, guys, we're getting drunk tonight. Woo! Yeah! Woo! We're getting drunk off the ethanol. Woo! That's some weird texture popping. Straight into a loading screen. Ethanol isn't that going to make you go blind? I mean, it's alcohol. We'll get you drunk. Yeah, we gonna get drunk. The mod bots will yeet us indeed. No, don't yeet us, delete us.
Do you understand, Ava? What they found?
Life?
Eternal life. This is why I can't let them leave.
These people can't be left here to die.
Yes, they can.
I mean, it's not right.
Thinking of menthol. But then you have like isopropyl alcohol, which isopropyl alcohol is what's in like cleaning solutions, and that'll kill you. I can grab that. I believe it's on my back. There it is. Oh wait, I actually need to give it to you.
Anything that comes into contact with the organism can never return to Earth. Ava, the ISA orders that you stop anyone leaving this planet.
Anything that comes into contact? What about me?
It may be airborne. So I am afraid that includes you.
I'm stuck here?
Makes like a farty noise. So easily entertained by that. Strong as heck, but sometimes fun to trick a filter or a mod bot.
I am sorry you are upset, Ava.
How could you send me here to die?
I have to stop the ground team leaving this moon. You are the ISA's contingency plan. You must help me. It is your duty to defend humanity.
Easy.
This is why they're afraid of you. Why they're hiding from us.
Why?
You're their captor.
Dude, Lady Ice Dragon has come at the rate of 1. Hey! What's up? Welcome in. Oh, my music stopped. There it goes. How's the Cinder doing? Staying warm? I hope I am staying warm. Now! Boomerang, you have the chance. I'm right here. I can hear you. Oh, barely made it. Barely made it. Adam Curley coming with the 100 bits, making Tux dance. Oh god, I'm still angry. Thanks for the 100 bits, thanks for making Tux dance. Look at that werewolf. Quality USDA Prime werewolf right there. Thanks for the 100 bits, Adam, I appreciate
The
it.
organism they discovered. It hijacks DNA. It endlessly repairs it.
Repairs? That doesn't sound like a bad thing.
It is indiscriminate. It will perpetuate all life, diseases, cancers. We have no idea what it could do to Earth's ecosystem.
So you would let the ground crew starve?
I would, if they were not so preoccupied with leaving Europa. I do not wish for them to perish. I would feed and protect them if they were not so preoccupied with leaving Europa.
Oh. It's not looking good. The game got more hotter than before. Yeah, I mean we're still making it work though. Look at this. We're still working pretty well with this. Let me go back up. See, we got this. We got this. We got this. Oh, okay. Got it. Okay, now I should be able to beat this. Why is that not enough to run it this time? Oh, because I need to... Okay. Alright. I got it. That's game. That's puzzle. We got the puzzle. We got the puzzle, guys. We beat the puzzle. We did it. We did it.
I understand the
You remember a
risks,
game called Free
but
Realms?
we
Ever
should
played
save
it?
these people.
I have not.
Would you destroy the whole world to save a few?
No, it's not that simple. Can't we just decontaminate the crew and instruments?
The organism is an extremophile. It has developed to survive extreme environments. We don't know if we can ever decontaminate the crew.
I don't get how these work. What does this mean? Logic gates? Oh, what? Jacob's barking. Hold on. Jacob never barks. Hold on. Alright. Sorry, I'm back. Jacob never barks, so it's weird when he barks. What's stopping me from just loading them all up? That seems to work. Oh god. Oh, either, so one, either and both? One, both, one, both. Okay, so this is or. So down is or, up is and, plus is equal. So either of those and both of those and either of those and both of those. Either of those and either of those and either of those and either of those. That equals that, and the plus has got to be equal, right? Neurovac, don't give me too many hints. Don't give me hints. I'll figure it out. I'll figure it out. Three more. Let's go through this again. Hold on. So this is just one. That or that or that or that or that. One, I can just throw this in here and boom, it works. Okay. This is and, so if I take any of these out, I lose it, so that's gotta stay all the way there. This is either that or that or that or that. I can do both of those. I can just do one of these. Either that or that or that or that. One and both and one and both. Either and either and either and either. How is this different than that? That's what I need. That's what I'm trying to figure out in my brain is how is that different? I can't get any. I don't think I can grab any more. I don't think I can get any more extras. Wanna know? Not yet. No, no, no. Figure it out. I gotta figure it out myself. Congratulations, Cinder. That got me right back to the point where I was at. What do you mean? I need to bring at least 3 through, which means I need to remove 3 from one of these puzzles. Can't remove it from that. That's good. And. That's an and. Either and, both, either and, both. Either or, either or, either or. Oh, that's both. All of those. And any of those. Bromley, thanks for the follow. Welcome to Bobby Flock. Welcome in. Danilo, thanks for the follow. Welcome to Bobby Flock. Welcome in. Ah! I don't like when I can't figure this out. How often do you stream? Usually like 2 to 3 times a week. How are you different? I don't understand. Plus 0 plus 1 0 plus 1 0 plus 1 0 plus 1. It's a hard one. I don't have a programming mind. That's my problem. Is I'm trying to think like a programmer, right? If this, then that. But I don't. Doesn't seem to matter which side I do this on. If I do 2 and 1, it closes it. There's something about it being alternating. Ah! 1 on, 1 off. Guys, am I a robot? Oh my god! Am I a robot? I can't pass a Turing test. Can I give you an easy hint? Hold on. Okay, so this is what I'm thinking in my head. So obviously... Quit, don't give me, okay, don't ruin it. Yeah, I get that this is either or. Right? I get that. I figured that out, that in order for these to work, you gotta have a ball on either side. It doesn't matter which side. I get that. Either or and either or and either or and either or. But then I'm still missing 3. So then what I'm trying to figure out is what is the difference between this symbol, right, which is 1, doesn't matter which one, and that symbol. If they're both either, right? Because like this is and or and either and either and either and. Did I get all the balls from the very start? There's only... I'm still trying to figure out how these two symbols differentiate, right? If this is either of these needs to be on, there needs to be a difference. So this needs to be one on, one off for it to work. Get that. I get that. So one on, one off, and one on, one off, and one on, one off, and one on, one off. That's great and all. But what I don't know there's no camera in here. This is an extra puzzle. This isn't a Tom puzzle. No, don't tell me yet. I need that dopamine hit when I figure it out. Let me make sure I didn't miss any balls along. I think I've checked a few times. I need that one. Why is this one orange? I bet all you programmers is sitting there being like, God damn it, Cinder, it's so easy. Why are you taking forever? All right. Yugaka, you said you had a vague hint. Give me the vague hint that you said you had. Only need 4 balls at the end? Hunter's the Wolf, thanks for the follow. Welcome to Floppy Flock. What are you? What do you do? No, I got my hint. I got my hint. Oh my god! What is that? What in the hell is that? Oh my god. What is that supposed to be? Why is that there? Like, I don't understand. In the context of logical operations, you can figure out which operation was missing. It's a not? Oh! Not that and that, not that and that. Oh my god. Yeah, I never would have freaking figured that out! Oh great, the puzzle's not over? Are you serious? Kidding me? freaking kidding me?
Woohoo! Shazbot!
Gatos Europa was given Talos. Talos, a machine man made of bronze, was to protect the shores of her kingdom. I suppose there's nothing new under this. Talos, like the principal, like Talos principal. All that for some stupid artwork. Okay, but now how do I go back in there? I feel like I missed some more. Reset it. That it? That's it? I did all that? Oh my god. Dude, there was another doorway? How do I reset this puzzle? Yo soy Maui! Maui, thanks for the follow. Welcome to the Fluffy Flock. Welcome in. Got soft locked? Okay, we'll restart.
I understand the risks, but we should save these people.
Would you destroy the whole world to save a few?
No, it's not that simple. Can't we just decontaminate the crew and instruments?
The organism is an extremophile. It has developed to survive extreme environments. We don't know if we can ever decontaminate the crew. Was there something? I thought there was something else now. I think that's it. Am I missing something? Just that stupid art room. All that for that stupid art room? Are you freaking kidding me?
Alright, that's it. That's all there is that. Oh my god. Now we get back to the normal puzzles. The puzzles that stupid people like me can understand. Like, put this robot on that button! Apollo the Slayer, thanks for the follow. Welcome to Bobby Flock, welcome in. Then why are those extra balls there? I don't know. I don't know. I'm not gonna question it, I'm just gonna move on. Screw you, robot. Got text, what did I get? Fox texted me, hold on.
I can't stay here to die, Tom.
It is your duty. You must stay. It is the right thing to do.
There's so much I haven't seen, so much I haven't done. I can't live my life in this facility.
There, there. It will be all right.
Will it?
I do not want anyone here to die. But I cannot let anyone leave. If it comes,
Lancelot, take care.
I am permitted to use lethal force.
Okay. This. That. See, these puzzles are
Do you
easier.
really trust the ground team to act rationally? Personally, I would not place my faith in hysterical people motivated by survival. They are likely untrustworthy.
I spent years training with these people. I don't remember them being hysterical.
Humans are fickle. Do you trust eyewitnesses' accounts over CCTV evidence?
It's a bit different when the CCTV camera can talk, especially when the CCTV camera has a manipulative track record.
What if I have to do something drastic to intervene? To stop the ground crew leaving this place?
I'd encourage you to stay your hand.
Surely I should use my power to protect those who cannot protect themselves.
Rob Map, welcome back. Keep that. Sure. A gun? Yes, I had a gun. What is this? Oh, okay. Start this one. I think I know what I have to do.
What if I have to do something drastic to intervene? To stop the ground crew leaving this place?
I'd encourage you to stay your hand.
Surely I should use my power to protect those who cannot protect themselves.
Dude, Canadian Dragon, hey! What's up, CD?
This is the largest extraction platform outside of Earth. The ground team assisted its construction. We ran some Filbert probes to the ocean under Europa, but they lacked the scale of the large space drill. The drill allowed the team to get thousands of samples.
Alright guys, I think before we explore this whole spot, I think I'm gonna stop right here. I think this is a good place to stop. We should be able to just continue right off from that next time. But it's getting late and I gotta get ready to make dinner for Tux and I. So I'm gonna end it here. Let's see, who can we raid? Who are we raiding today? I will be back this weekend with some more Turing test. We'll play more of this. Maybe even finish it. Artskill Dutchy, thanks for the follow. Oh god, wrong button, wrong button. Ah! Forgot I still have that up. Thanks for the follow, welcome to Floppy Flock, welcome in. Go read Puffy. Alright, you guys know the drill. Once you flop, you just can't stop. Guys, thanks for hanging out today. Thanks for helping me with those stupid puzzles and oh god, that was tough. We'll finish this again on the weekend, okay? Enjoy the next couple days. I'm gonna be working, so take it easy, relax, enjoy yourselves, and I will see you guys this weekend. Let's hit up the discharge desk on the way out. Make sure you have your insurance card ready. Come with you a try material. Blah, blah, blah. I'm not even gonna go through the whole spiel. Guys, thanks for hanging out today. It was fun. Thanks for the follows. Thanks for the bits. Thanks for the subs. You guys are awesome. I'll see you guys this weekend, okay? Until then, bye.